Hello, this is Dr. Jamali at OMS of NY. I'm here to answer some of the most common questions asked about impacted teeth. Impacted tooth is when you don't see the tooth. It's under the gums and under the bone. Causes of the impaction of the teeth are age of the patient, the length of the jaw and the volume of the bone and the space that is available, and the crowding. Impacted wisdom teeth or any tooth really doesn't have any symptoms. They're usually painless unless they get infected somehow or they cause cysts. Impacted teeth can affect the oral health by damaging the teeth next to them or damaging the roots potentially, or they may not cause anything. They may also cause cysts or tumors in the jaw. So if you have any impacted tooth, you should really have a panoramic x-ray taken by your dentist or oral surgeon every 5 years at least. The difference between partial and fully impacted tooth is when the tooth is partially erupted in the mouth, so you can see a corner of it somewhere, and fully bony impaction is when you don't see any part of the tooth and its bone is covering the tooth completely. Diagnosis of the full bony impacted teeth are only made by cone beam scan, which is a 3D scan, or panoramic x-ray. So on the x-ray you can see the tooth being under the bone completely and if whether or not they're damaging the adjacent structures. Treatment option for the impacted wisdom tooth is whether you can leave it alone if it's not damaging the teeth next to it or doesn't have any pathology around it. If the surgeon feels that the wisdom tooth may cause damage in future, then we take the tooth out surgically. The removal process of the impacted wisdom teeth is we usually do IV sedation for the patient. Once the patient is asleep, we provide local anesthesia. We always numb up the area even if the patient is sleeping. Then we open up the gums, remove the bone over the tooth, and the tooth is sectioned into pieces and we remove it, and then stitches are done. The stitches usually fall out after 2 weeks. Cost of the removal of impacted teeth really varies depending on the level of impaction, and the insurance usually covers 50 to 80% of the fee. You will be responsible for your copays. Patients should expect relaxation and actually sleeping, hopefully during IV sedation, during the removal process of the wisdom teeth. Afterwards, they may experience some soreness for a couple of days, some swelling, and some tenderness and bruising, depending on the age, depending on the skills of the patient, age of the patient. Impacted canine tooth or the eye tooth here is a very important structure. It can be impacted when the jaws are usually narrow or there's not enough space for the tooth to be erupted. It usually erupts around 11, 12 years old, and if it's impacted, then the baby tooth is retained. So typically orthodontist sees this first. They refer to the surgeon to expose the tooth, and then orthodontist puts a chain on the tooth and slowly brings them down. Horizontally impacted wisdom tooth is basically in the bone. If this is the adjacent tooth, this is the wisdom tooth, it's horizontally impacted. You don't see the tooth. The other kinds of impaction are mesioangular impaction, which is the wisdom tooth is in angulation or uprighted. Thank you for listening. I hope I have answered some of the questions asked about impaction of the teeth. And if you have any other questions, please visit OMS of NY or call 212-480-2777.